Yeah, hi. Hello, good evening, everyone. With me is Dr. Vineet Goel, and this is one of the rare combinations that we have. He already has choices between two of the biggest things that he can think of. Yeah, I have interviewed him just like couple of weeks back for his brilliant score of rank. Vivek, what was this? 3 or 4 in the NEET
Fourth.
SS? 4. And then I am again interviewing him for a fantastic success that he has in AIMS merit list being 9 and common merit list rank 10. So this is the double success that Dr. Vineet Goel has achieved. And I think if you sum up the 3 scores, he'll be the one who will be topping among between the 2 exams. He's the only one probably who's got highest dimension qualifying with the top ranks in both the exams, or 3 exams if you can count it that way. 2 exams and 3 merit lists. So congratulations, Dr. Vineet.
Thank you so much.
So, Vineet, I think you've already shared a lot of tips with with me in the interview for the preparation of NEET SS. So, let me take some extra highlights from you about how you should be preparing between NEET SS and INISS preparation strategies. And was it a separate strategy that you were following, or was it the same strategy of preparing for the subspecialty or super specialty of cardiology, and along with it, the medicine part, which actually culminates into success in both the exams?
So the strategy is not completely different, but it's a bit same. The You have to focus mainly on the subject of choice that you are giving in INISS. So I didn't study the rest of the subject between this period between the NEET SS and INISS. I mainly focused on the cardiology part. So they asked mainly questions in cardiology. So I read tables from Braunwald and did MCQ of the super specialty part of doc tutorial in this period.
Right. So when you were preparing, I think we have discussed this in your other interview that we did for your NEET SS success story. You were preparing for the cardiology from the textbook or a hardcore book like Grunwald, and you were doing medicine from Harrison. Is that correct? That's how you were proceeding in your residency?
Yes, sir.
Right. So, because that is when you have the clarity that that's the subject that you want to choose. So it makes things much easy. But for somebody who's not been prepared or was clear about as to what branch they want to choose, how would you advise them to prepare integratedly or retrogradely? I'm deliberately trying to keep questions different from what I've already asked you in the previous interview, so that we can have maximum out of your knowledge sharing for the next generation to follow it up with them for their preparation. So there are two strategies which people generally call antegrade and retrograde, as in read the theory first and then do the MCQs. The other strategy that a lot of people actually adopt, which I was discussing with some of our students in the other interviews, one was that they were doing retrogradely, as to they will go to the Q bank, do all the 50,000 questions in the talk tutorials Q bank cardiology, and then the questions they don't get, they go back and read those topics and prepare accordingly. So which of the two strategies? I'm sure you must have done that when you got some question incorrect, gone back to the books and tried to see that. So what do you think? Is it a mix of the two, or either of the two strategy is better?
Sir, either of the two strategies better, but first of all, we have to read Harrison first. Then we have to proceed to the doc tutorial, to the MCQ part. So for super specialty part, retrograde approach is much better because the important topics are highlighted in MCQ, and then we can go back to the book and see those topics only, because it is not possible to read whole book, whole Braunwald book, because some topics are not that important. So retrograde approach is
Absolutely.
good for super specialty part.
Right. Also, we were discussing this last time also in your NEET SS preparation, but from the INISS preparation, Vineet, when you were appearing for a elite test series, which for the doc tutorials, which you have the question bank, your ranks were reflecting very much your standings otherwise amongst the group, and that's how it is reflected now in the exam. Because that was a pan India kind of entrance. Anybody who's interested in preparing, say, grand test for cardiology or elite test series in cardiology, would actually be competing with you. So what was your rank in those test series, and does it actually reflect how you were doing in those exams? Are those ranks matched here as well, or they were very different?
Sir, it was similar only. It was variable, bit variable, but it was similar only. I was in top 10
I
in
know
those
that.
tests. Yes, sir.
Yeah. So that's the reason. I mean, so that probably reflects that the Q bank and the test series and the elite test series, that kind of that we have created, very much actually goes on to emulate and reflect the kind of questions that are tended to be asked. And the series is so vast that it practically covers everything. So you also raised a very important point, not to cover unnecessary topics. For example, there are a lot of modules and places where you'll get extensive coverage of pediatrics, which deliberately is very limited in our videos that we do, or the questions that we do, because that's very rarely asked. But if you look at the clinical cardiology, like JVP, as we had discussed last time, the questions would be tremendously repeated and number of questions would be substantial. So do you think that strategy, not in terms of number of pages in the Brunwald, but in the strategy of division of studying in terms of proportion of topics that are asked, is a better approach? For example, say acute coronary syndrome or ischemic heart disease, you have 400 pages, but question asked will be maybe four. But you have
Yes.
like 40 pages of clinical cardiology and you will have 7 or 8 questions. So is that proportionate effort good enough, or you have a strategy around this as well, as to how you used to prepare for those topics?
Sir, basically, for ACS, questions on ACS, that's an important topic. And many every year they ask question from ACS and repeated topics like atrial fibrillation. So we have to read those topics from Harrison, and we have to read those topics from Braunwald, mainly the tables that are important, and recall question on those topics also we have to see
Absolutely.
those.
But clinical topics,
So clinical topics like they asked
KVP?
this time they asked the South Africa sign in
Yeah,
ECG.
this time.
Yes,
Yes,
sir.
South African flag sign.
Yes, sir.
So
So
that that is exactly
these
picked up from one of the test series that we had put, and
yes,
also
sir.
it's
And
one video lecture that we have on ECG localization of myocardial infarction. There's
yes,
a
sir.
video that we have uploaded. This is a one lecture that's not there even in Brunwald. This is actually from the other textbook that we read, but this is a very important. And then they've asked that question very directly. So
Yes.
how were you preparing for those kind of topics?
Sir, these topics mainly, sir, ECGs. You used to ask in WhatsApp group also. Some ECG you used to put
Right.
ECG in WhatsApp group, uh, and they you have to study these types of ECG like this only. You have to
Yes.
follow some pages on Insta, or you have to add. You have to be in some WhatsApp group for these, because you
Yes.
cannot learn every sign like this.
Absolutely, because I remember the South African flag sign ECG had posted in WhatsApp group. This again yesterday, one of the students was also I mean mentioning it कि सर आपने वो डाला था उस समय तब हमने देखा था, so we realized that ये होगा. And one of the student who's a good student, I'll not name it, he got it wrong and he said सर वो मैंने नहीं देखा था. And the other guy who got it right was सर वो WhatsApp group पे देखा था. So yeah, sometimes you're right. I mean, you cannot have a book to
Yes,
tell you all kinds of ECG signs.
yes,
So the spotter video, there is a video there where we do spotters, and I think there again this time there were two spotters. One was a supracardiac TAPVC, other was AF with WPW. Both were asked again. Those
yes,
are the
sir.
two practically favorites. So thus there is a free video on YouTube of mine where we do the spotters. Now you've gone through it. You've mentioned it last time also. But I mean, how many spotters do you think that you need to? I mean, the spotters can run in thousands. But do you think there are certain specific areas, like I gave you the two examples, that need to be focused for the spotters, and that should be good enough? Because I think time is very important factor between your NEET SS and NISS, and you cannot go through everything in all of the syllabus.
Yes.
So how were you choosy about picking up the X-ray, ECG, or CAT kind of spotters?
Sir, mainly those topics which are important. Like in congenital heart disease, there is ASD. Last time there was X-ray on ASD also, and TAPVC, Snowman sign like this. So we have to read these topics mainly, and we should not go on rare disease. We should
Right.
ignore those disease, because all questions we cannot get it correct. So we have to just focus on the important things, important topics, to make it right.
Right. And Vineet, you also had been part of the interview group. So we do that. You interview. I remember you being there attending it. Like 40
Yes.
students were there who attended that interview group in 2 sessions. So how helpful were the mock interview sessions that we did? Learning through the questions. Were the questions on the similar line as were discussed in those groups?
Yeah, yes, sir. It was on similar line. First, they ask question on thesis. Then they usually ask question on some clinical scenario, and then some trial. So it was pattern was same, similar. So it helped a lot. Sir.
Right. So that's Vineet. A very great success and a grand celebration is demanded on your part. So it's going to be a very tricky question. You are in one of the topmost institutes right now with through the NEET SS also, and you are actually tending to get one of the seats either in the one of the premier central institutes or PGI or say AIMS. That's very likely that you'll get either of the two cases. So it will be a difficult situation, but I'm sure a bright person like you will make a wise decision, and whatever decision you'll make it right. So I'm very happy about it that you
Thank you.
have the rare opportunity of striking it double. You know, both test match bhi jeet liya, T20 bhi jeet liya.
Thank you,
So,
sir.
what are your final comments and tips that you want to give to our students about how they should start preparing when they are doing right now their third year, focusing between balancing between MD degree and preparation for their super specialty entrance exam, be it NEET SS or NINSS?
Sir, first of all, read Harrison. It will help in non cardiology part and cardiology part also, and it will help in prof also. Then we have to practice MCQs, which is doctoral is sufficient for MCQ purpose. Then we have to see after profs, we can see recall videos and questions also. It will help a lot. And then Bronwald tables, important for important topics only, which are repeatedly asked, which you can see which topics are repeated from recall questions.
Right. And so, how do you rate your experience with doc tutorials out of 10?
Sir, 10 out of 10, sir.
And your faculty, myself, are out of 10?
Yes, sir, 10 out of 10, sir.
Thank you. Thank you very much, Vineet. So that was Dr. Vineet Goel with his stupendous success in both the formats of exams, and we wish him all the best. And Vineet, I'm here telling you again that I'm always there to help you out. I mean, I'm glad that he opened up about his choosing seats before we actually went live as to sir kaise choose kare kya kare, and I can assure you that I'm there even wherever you go, whenever you want me, as a faculty or as a friend, as a senior, as a mentor. Even though your doctoral subscription may end, but as a faculty for cardiology or as a mentor, I'll always be there to guide you and help you out. So be there with the doctorals as well.
Thank you, sir.
Okay, that's Dr. Vineet Goel. All AIMS merit list 9 and common merit list 10 and NEET SS rank 4. Thank you. Good night, everyone. Take care. Bye bye.